Micturition is a term for urination. We could also use the term voiding. All mean the same thing, to release the urine out of our bodies. And in order for micturition to occur, three events have to occur at the same time. The detrusor muscle, remember that's the muscle in the wall of the urinary bladder, must contract. That's controlled by the autonomic nervous system involuntarily. The internal urethral sphincter has to open. That's also controlled involuntarily by the autonomic nervous system. And opening of the external urethral sphincter has to occur simultaneously as well, and we control that voluntarily with our somatic nervous system. So let's take a kind of a closer look at these three simultaneous events for micturition. So first we're going to look at a simple spinal reflex here. So this is before we are trained to use a bathroom, before potty training. It's just a simple spinal reflex. So what happens is the urinary bladder fills, it stretches the bladder wall. So we're going to have those afferent or sensory impulses from the stretch receptors. It gets stretched, it sends an impulse to the spinal cord, the simple spinal reflex, and that's going to result in three things. Increased parasympathetic activity. Remember, parasympathetic is rest and digest. That includes urination. It's going to decrease sympathetic activity because these are always opposite of each other. And it's also going to decrease somatic motor nerve activity. Now this is typically voluntary, but in someone who's less than 2 years old, hasn't been trained yet to use the bathroom, this will happen automatically. So when these occur, well, that increased parasympathetic would cause the detrusor muscle of the urinary bladder to contract, and the internal urethral sphincter opens. And because of decreased somatic to the skeletal muscle of the external urethra, that external urethral sphincter will open. So the result of all three simultaneous events will cause voiding or micturition, urination. Now, once we learn how to control our bladder, those stretch receptors will send the impulse to our brain, our higher brain centers, and it's located in the pons. So we have a pontine micturition center and a pontine storage center. We decide, do we want to urinate or do we need to store it a little bit longer? So let's take the micturition center route. That will send the impulse to perform all three things just like the spinal reflex. But the only difference is we're deciding to do this. So the detrusor muscle and the internal urethral sphincter is controlled by the ANS, and the external urethral sphincter we control with our somatic nervous system voluntarily, but it's our pontine micturition center that will drive that process. Now, if we want to store our urine, our pontine storage center will inhibit micturition by acting on all three spinal efferents or motor neurons. So just the opposite of this, we're going to decrease parasympathetic, increase sympathetic, opposite, and increase opposite our somatic motor nerve activity. That means the detrusor muscles will not contract, the internal urethral sphincter will stay closed, and the external urethral sphincter will remain closed. I'm pointing here, but it's the opposite when we go down this route. So micturition will be inhibited. So those pontine control centers mature between ages of 2 and 3 normally. Micturition usually occurs before we get to 400 milliliters in our bladder. Right? We can hold 500, even double that, but once we pass 400, that's when the sensation to void gets stronger and stronger. And after normal micturition, there's a small amount that remains in the bladder. And a couple clinical conditions with micturition, something called urinary incontinence. This is in adults, and it's usually caused by a weakened pelvic muscles. Incontinence means urine is being released when you don't want it to. So two types. Stress incontinence is when we increase our intra-abdominal pressure, causing urine to be released when we don't necessarily want it released. So how do we increase intra-abdominal pressure? Laughing, coughing, sneezing. That can cause the incontinence because of the weakened pelvic muscles. Overflow incontinence will occur when urine will dribble out when the bladder overfills. So it's not increasing intra-abdominal pressure, it's pressure within the urinary bladder itself causing the incontinence. And finally, to end the chapter, the opposite of urinary incontinence is urinary retention. That means someone is unable to expel the urine from their bladder or has a very difficult time expelling the urine from the bladder. Some causes is, general anesthesia. It could happen temporarily because that anesthesia works on the detrusor muscle, and without the bladder contracting, there can be no micturition. In men, enlargement or hypertrophy of the prostate, because recall, I'm going to the picture, prostate gland surrounds the urethra. So if it becomes enlarged, that puts pressure on this urethra and will close it and block exit of urine from the urinary bladder. So there's another cause of retention, and treatment would be a catheterization, since if urine cannot be released because of a enlarged prostate, a catheter through the urethra will open up that blockage and allow urine to flow. Of course, that would have to be done every time someone would have to void.